Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. For the parent of a teenager, what could be more worrisome, maybe terrifying is the right word, than wondering about your adolescent's sexual experiences? To help shed some light, every other year, the city's health department surveys the sexual behavior of our public high school students. The latest results do in fact indicate some surprising findings. Here to tell us more from the Department of Health are Dr. Preeti Pathela, a research scientist and the author of the study, and Dr. Susan Blank, Assistant Commissioner for the Bureau of STD Prevention and Control. Thank you both for being here. So tell me, may I say Preeti?
Of course.
What does this survey do and how? Just what do you do?
Well, there's a survey that's done by the New York City Department of Health in conjunction with the Department of Education. It takes place every 2 years in public high schools. And students are asked in the classroom to fill out a survey. It's self-administered, it's anonymous, and they're asked about...
Just explain anonymous. I know that
Sure.
We all know, but just in case.
It means that the student does not have to write down his or her name or any other identifying information.
So it's completely student A, nobody knows anything about them after they hand in the survey. Okay, go ahead.
Correct. Yes, so each year this survey has 99 questions on it, and it runs the gamut of health behaviors, such as how much physical activity do you engage in, what kinds of foods you're eating, and also the sexual behaviors of these students are asked on the survey.
What year was the survey that you just did the analysis on? What year was that done?
The analysis was done for 2005 and 2007.
So my question is, we are going to hear some surprising facts. Do we have any trends to show us what's going up and what's going down yet?
We don't yet. In the future, now that we've uncovered what we have, we will be looking at how things change.
Okay, and Dr. Blank, can I call you what I call you every day at work, Sue?
Absolutely.
We know that you deal with a lot of adolescents in your clinical practice. Were any of them interviewed in this survey, or
No.
was it only high school students?
This is a survey that's done in conjunction with the Department of Education, and it is done entirely in the New York City public high schools.
So we can't extrapolate. We can't say that the same behaviors that you analyzed and found would apply to students in private schools, because it was only done in public schools. Is that correct?
That is correct, yes.
Okay. So tell us some of the findings.
Well, we found that out of about 17,000 students who responded on these 2 years of the survey.
Very large number.
Yes, it was a large sample. 40% reported that they had had sex, which is not surprising. That has been consistent throughout the years. But we found that almost 1 in 10 of those sexually active students reported having a same-sex partner.
We often talk about same-sex partners in the health professions, but that's not the way it's said in the street for the most part. So would you just say the way somebody would tell you if they came into your clinic, how they would say that?
Well, what's interesting is that they might not say that they are bisexual, which is one way that people might identify themselves. They will generally tell us what they think of themselves as, which may or may not be the same thing as what they're actually doing. So
well,
I might say I'm straight, and I might believe I'm straight, but in fact, I have male partners and I have female partners.
Is that what you mean, 1 in 10?
Yes, so 1 in 10 students reported that they had a partner who was either of the same sex or of both sexes. So a boy who had both male and female partners.
Were you able to tease out whether or not girls were, quote, bisexual more often than boys, or boys more often bisexual than girls?
Yes, we looked at this, at these data by sex. So we looked at males and females separately.
Okay.
And we found that the female students, about 9% of them reported being bisexual, whereas only 3% of the male students reported having both male and female partners.
Which I find completely surprising. So it is very interesting because many times we don't think of girls as having two different, having partners of both genders. What kinds of issues were raised because that you found, other than that they have male and female partners? What kinds of issues went along with this bisexuality, if you will?
Sure. So for both males and females, the ones that reported having both male and female partners, they were reporting riskier sexual behaviors. So they were less likely to have used a condom the last time they had sex. They were more likely to report having more partners and to have initiated sex or had sex for the first time at an earlier age.
The other question is during this survey, one of the 99 questions, did you ask any of them about their availing themselves of health care, whether or not they had seen their doctor or discussed it with their doctor?
No, unfortunately, we don't have any information on that. Another thing that we did find in the survey, which was troubling, was about sexual violence. So we found that the kids who were reporting having both male and female partners also had experience with either dating violence or having been forced to have sex in their lifetimes.
We're going to take a short break, but we'll be right back with more of our conversation. Lots more to talk about. We're back with Healthbeat Brooklyn, talking about the recent survey of New York City teens and their sometimes risky sexual behavior. With me again from the City Department of Health is the author of the study, Dr. Preeti Pathela, and Dr. Susan Blank, Assistant Commissioner for the Bureau of STD Prevention and Control. Before we went to break, we were talking about sexual violence, and it made me wonder whether or not you ask any questions about drug use, because of course drug use, starting with alcohol, influences a lot of the behaviors that teens as well as others experience. So did you ask any questions about that?
Yes, there was one question on the survey that asks about whether the student had used drugs, including alcohol, the last time they had sex. And we found that those students who reported having both male and female partners were more likely than other students to report having used drugs and alcohol.
Did you look at drug and alcohol use and compare it to condom use for the ones who did and the ones who didn't?
No, unfortunately, we did not. We looked at them as separate issues.
Okay.
But I think it raises some important points. You know, what we see from this is that, first of all, some of our teens are sexually active. They engage
a lot of our teens.
40% in the last round of public high school teenagers reported being sexually active. We also see that there is a whole spectrum of sexual activity that our teens engage in. And I think that it really brings us back to the fact that healthy teens are really everybody's business. As at a societal level, we need to make sure that teens have the access to the sexual health services they need. And luckily in New York State and in all other states, adolescents can get sexual health care, and including HIV testing,
STD,
other STDs, including contraception, without parental notification. They can provide their own consent for those services.
Well, I know for New York State for sure, but in case somebody sees this that's not in New York State, is it also true in other states you just mentioned?
For sexually transmitted infections such as chlamydia, gonorrhea, and syphilis, it is true. Okay. I don't know about the HIV.
Okay. But certainly in New York City, you do not need parental consent?
Absolutely do not.
And the clinician, doctor, nurse has to keep it private?
In fact, by law, these things need to be kept confidential. And, you know, I think that's another really important point is that the medical community has a real responsibility for making sure that adolescents getting health care have an opportunity to have a discussion about their sexual selves and any drug use that they may be engaged in, and be able to speak freely with their providers. So it is really a fine art of making sure that a provider can get the parent out of the exam room, or that a provider can set limits with a patient to be clear, these things are off limits to your parents?
Well, that has to be really one of the first things that is communicated to an adolescent.
Absolutely.
The conversation we're having is between the two of us, and I am by law not allowed to communicate, to talk about what happened in this room. And so that is a very important point that we want to get out there. Now, the other issue is regarding adolescents who may not have insurance, so that they can't get their card from their parent or whatever it is. What are some of the ways that they can get services?
Well, actually, in New York City, we're very lucky. The City Health Department has 9 free and confidential clinics where teens can come, anyone as young as 12, without parental notification, without proof of insurance, without proof of immigration status, and they can be seen on a walk-in basis. We're open Monday through Saturday, and our facilities are listed on our website or through 311. All our services are provided for free, including screening for sexually transmitted infections.
Including HIV.
And HIV. They can get their HIV results the same day. We provide emergency contraception for those who need it. And I think it's also important to remind teens that, and their parents, that there are also vaccines available.
When you're an adolescent, sexuality takes on a lot of emotional time and mental time and more and more physical time, and it is a very important subject, but of course there are others. So in the survey, would you tell us anything else that was found? I do remember you saying that the 1 in 10, was it 10% almost?
Yes.
So just run down the things that we found out about the 1 in 10 students, the 10% of students that were, quote, bisexual. First of all, what did you say we should use behaviors not...
Right. So adolescents who have same-sex partners and opposite-sex partners. And for convenience, we say bisexual.
But we should talk about behaviors,
really
not
behavior.
labels. So
Correct.
would you just run down the few things so we can end up knowing all of the things we found out, because it has implications for what we all need to do.
Right. So we found that about 10% of the students reported having a same-sex partner, either the same sex or having both sex partners of both sexes. And we found that the majority of the both sex, the ones with the both sex partners, reported behaviors that put them at an increased risk for sexually transmitted infections, including HIV. They were reporting less condom use, more drug use with sex, more partners in general, and more experience with sexual violence. Also, 40% of that group reported being straight. So their identity is not matching with the sex of partners that they're reporting.
So we're going to have to leave it there, but it really gives us a lot to work with to know what it is we all should be doing for healthy teens.
Talking to our teens.
Talking to our teens. Thank you very much.
Follow us on Twitter at BK Independent TV.